Hey Bobby, how are you doing today?
Good today.
Good. So about a month ago, we did the Intracept procedure on you, is that right?
Yes, sir, you did.
And the Intracept is where we place some heating probes in 3 different vertebrae in your lower back that
Right.
it changed that MRI that I said, gee, I think that's the residual cause of your back pain.
Correct.
And how are you doing since then?
And 90% of the pain is gone completely. I mean, I can do a lot more than my life today than I did yesterday.
And you've had pain for quite a number of years.
Over 20.
Well, you said you first injured yourself back in the 80s, you said in the Air Force,
Yes.
and then another wreck that you were in, and then in 2010 you were driving a truck and more back pain from that.
I made a living driving a truck for about 5 years, and that took a toll on my back too. And that's when I started the rhizotomy treatments back in 2010.
Right, so you had radiofrequency where
Right.
where we denervated the facet joints. It was done in Charleston, and then you came to see us, and we've been doing that, 3 or
Yes.
4 times since then. But they stopped working quite as well as they
Yeah,
were.
they
correct?
didn't last as long, and they didn't do 100%. 80 to 100% of the pain didn't go away.
Right, so it was less and less effective. So anyhow, I got a new MRI and I noticed you had these motor changes there, these changes that we can see, color change of vertebrae, and I said, I think I know where the remainder of your pain that was
Right.
coming from that the radiofrequency was no longer getting. So you were very in favor of trying something new because you're getting a little desperate there.
It gets tough and tiring living with pain in your back all day.
Well, you said you couldn't even sit very long.
No.
You were just changing positions all the
It
time.
was a
and-
constant movement.
constant, and you just couldn't sit, you couldn't drive.
No,
I mean, just life was not very tolerable.
no, it was miserable most days.
So then things really changed a month ago, and when did you first notice relief after the procedure when we did it? How many
Within 2 days,
2 days, and you noticed a lot better, and then within, you said a couple weeks, it was completely gone.
2.5 weeks, it was complete.
Like 90%
Yeah.
gone. Yeah.
And today it's 0% pain.
Wow. So what can you do now that you couldn't do before? How has it changed your life?
Well, I get out and work more in the yard, and I can go fishing. I can stand up and walk around, and I
And
can
sit
down and
and you can
relax.
sit, and you can drive, and so really it's been
Correct.
pretty life-changing for you, hasn't it?
Yes, sir.
And the nice part about this is that it's one and done. I mean, we've done that. That does not need to be repeated. That nerve does not grow back. Unlike the radiofrequency that does grow back and stop
Right.
working, this nerve, as far as we know, there's like 10-year data that shows that where you are now is where we anticipate you're going to be for the rest of your life.
So
So
I can't complain
That's really-
about
that's really
that.
nice.
I'll
So-
take that any day of the week.
and I'm glad to have been part of your treatment and be able to offer that for you. So
Oh, I'm
great.
glad you came out with that. I didn't. That was one that I hadn't heard of.
Well, we kind of try to push the envelope here and get the latest technology here. And
Well, you did a
others
good
are
job.
patients.
Anybody that wants, I mean, if they need the low back pain gone, that's.
I can't guarantee that for everybody, but in your case,
It worked for
certainly,
me.
certainly. Yeah. Well, we don't quit till we at least have tried everything potentially possible.
And that's
you know,
a good thing.
So it's great. Okay. Well, thank you.
I appreciate it.
Okay. Great.